We're back for Your Ears Only. I'm David Alpern.
I'm Catherine Herzog with this news quote. I'm not saying Iran will not react, but it will be nothing like London in World War II. That was a retired Israeli official voicing the growing government consensus that a military strike on Iranian nuclear facilities would not trigger a suicidal counterattack. Tehran, meanwhile, threatened to terminate all oil exports to dependent European nations, even before the summer embargo they agreed on to sanction Iranian nuclear development. Now this.
I will not go back to the days when health insurance companies had unchecked power to cancel your policy, deny your coverage, or charge women differently than men. I'm a Democrat, but I believe what Republican Abraham Lincoln believed. The government should do for people only what they cannot do better by themselves and no more. That's why our health care law relies on a reformed private market, not a government program.
That President Obama's re-election year State of the Union address made only passing mention of his signature domestic policy success, healthcare reform, was perhaps understandable. The Affordable Care Act, with its universal personal insurance mandate, is far from universally popular. Only 42% of Americans approve. And it faces a high hurdle in March at the Supreme Court, with a decision due before Election Day for better or worse.
But the state of healthcare is an unavoidable factor in the actual State of the Union, with 40% of American households now struggling to pay their medical bills and costs rising endlessly. Veteran healthcare journalist Steve Jacob takes a nonpartisan look at the country's healthcare future in his new book, Healthcare in 2020, where uncertain reform, bad habits, too few doctors, and skyrocketing costs are taking us. And he's on the line now for Your Ears Only. Welcome to the program.
Thank you very much, Kath. I appreciate that.
Were you surprised at the president's near avoidance of the topic during his State of the Union address?
Not especially. From my vantage point, I think he thinks it's already done. He thinks that health reform is on the way. It's going to get done. And I think, to me, that was sort of a presumptive approach on his part. It was interesting, right at the top of this piece where you played back what he said during the State of the Union. There was a blogger on the Journal of American Medical Association site the other day that said that out of almost 7,000 words of text, only 44 words were spent on healthcare. And that's like 0.6% of the text. And that's as opposed to the last couple of years where, it was almost 7% of the entire speech. So, healthcare has receded as an issue. From Obama's perspective, he thinks it's done, and he thinks he's going to get reelected. And then Republicans, Mitch Daniels, who's done quite a bit in the state of Indiana, also pretty much ignored the issue too. So we're sort of in this interesting interlude where people are waiting to see what the Supreme Court does, and then also see who the nominee is.
Critics say healthcare reform plays to Obama's vision of big government, not to the interest of American citizens. Others say his reliance on private enterprise makes the medical insurance marketplace the biggest beneficiary. What's your view?
My view is that essentially a lot of these ideas have sort of been labeled or relabeled. The individual mandate was born as a Republican idea in the 1990s, and so was the health insurance exchange. The whole idea that insurance companies would compete for everybody's business. So, from my perspective, I'm not so sure whether you consider it a big government thing or whether you look at the aspects that are, in fact, introducing competition within the healthcare industry. So it's sort of not all one or the other.
If Obamacare survives the Supreme Court, you write that the U.S. healthcare landscape will change more in the next decade than in the last 50 years. In what most noticeable ways?
Well, I think what's most noticeable is what health reform does do. There's a lot of things it does not do, but the one thing it does do is essentially nearly wipe out uninsured Americans. Certainly there are going to be certain pockets of those. Certainly undocumented workers can't get insurance. But, that is the first time really in American history where nearly everyone will have access to health insurance. Now, how affordable that will be, we'll see. So that's really the change with health reform. But I think the bigger changes are going to be the fact that we're going to have real problems with access to physicians because so many more people are going to have health insurance, plus the fact that we've got an aging population. And then it's also the fact that these skyrocketing costs are not going to be altered at all by health reform. They might actually accelerate them a little bit.
What kind of companies are most likely to stop offering health insurance once private health exchanges are widely available as a source of policies?
Well, I think the companies that are most likely to are the ones that right now offer it but don't really need to on a competitive basis. And what I'm thinking of is sort of low-wage transient workers. If you look at the retail industry, if you look at the entertainment industry, if you look at the hotel industry, those kind of folks are pretty much in some of the service and wholesale industries. I think they're going to look at the economics of this thing and say, look, we'd rather just pay the penalty than have to pay health insurance benefits.
Both political parties agree that healthcare is too expensive, but you write that 30% of all medical care delivered today has no benefit to the patient. Why not, and what kinds of care in particular?
Well, if you look at over the last 10 years or so, there's a lot of certain procedures that are being done that weren't done 10, 15 years ago, and they're done 2 or 3 times more often. You know, MRIs, certain kinds of scans, and the population health has really not changed that much. So what we're seeing is an awful lot more procedures that because the technology is there, and because it will in fact be paid for either by the insurance company or the Medicaid or Medicare providers go ahead and do these procedures. Let me give you one example. Angioplasty, where they put stents in your arteries, if that's done within 24 hours of a heart attack, that may well save your life. But if it's done after 24 hours, it doesn't do anything. But there's still a significant percentage of these expensive and invasive and potentially dangerous procedure that's still being done that science says is of no benefit. And there's many, many, many things across the healthcare industry that are sort of like this.
Veteran journalist, editor, and healthcare columnist Steve Jacob is also an adjunct professor at the University of North Texas School of Public Health. His new book is Healthcare in 2020, where uncertain reform, bad habits, too few doctors, and skyrocketing costs are taking us, from Dorsam Publishing.
Quote from the news, what did we learn today? Things are bad and they're not improving at the rate they want them to improve. That was Kevin Logan, chief U.S. economist at HSBC Bank, on the Federal Reserve's promise to keep interest rates near zero until late 2014. Overall growth advanced by 2.8% on an annual basis, fastest pace in 18 months, but a little weaker than expected.
Next, an insider on Oscar, for your ears only.